Good morning, everyone. It is Saturday, October the 24th, 2020. It is currently 10:22 a.m. Central Time, and I'm coming to you live from Victory Baptist Church, located here in Ovalo, Texas. I'm sorry if I sound distracted. I was sitting here looking at some news headlines and realized I'd accidentally pushed the go live button. And once I go live, I'm live. So I all of a sudden I was looking at the headlines and looked over and like, wait a minute. Wait, we're live on the air. So it was an accident. I set down my iPad on the laptop, and next thing you know, we're live on the air. So good morning, everyone. Welcome back to another live broadcast. Victory Baptist Church. This is the Theology Central podcast, where we try to look at the world from a theological perspective. Now, as you can see by the title that I had ready to go, and I was going to go live here in a few minutes, I was still gathering information. We have to talk about a subject that I know you probably don't want to, to be honest with you, I don't even know how many people will even tune in to listen to what I have to say in regards to this subject, because there is definitely a COVID-19 fatigue among many people. They're tired of hearing about it. They're tired of talking about it. They're tired of thinking about it. And they just want to go on with their lives as if there is no pandemic, as if COVID-19 isn't a big deal. We have nothing to worry about. Let's just go on with our lives and forget about it, right? They'll be like, there's nothing we can do. We just have to live with it, right? We just have to live with it. Now, typically the people saying, hey, we just have to live with it are the people who haven't had a loved one die from it. Now, once it's their loved one, once it's their family member, then they're not going to be so receptive to people saying, hey, we just got to move on. We just got to live with it. They'll probably be a little less likely to have that mentality. And let's be honest, we all kind of operate from that perspective. When it hurts and when it impacts other people, we're not usually too bothered by it. But when it hits close to home, then all of a sudden we become very bothered and very upset by it. We all know that that's the way and operates. I mean, take COVID-19 out of the picture. Just take COVID-19 out of the picture. You can read on the news about a shooting and 3 people get shot and you'll be like, oh, that's horrible. That's tragic. And then, 5 seconds later, you're like, what's for dinner? You've already forgot about it and you moved on. But if one of those 3 people were a part of your family that were shot, all of a sudden it's life-altering, life-changing. Everything stops because now it hit close to you. When it hit them, when it hurts them, we all need to move on. When it hits you, there's no moving on. Then the wheels come off and everything begins to fall apart. We all operate that way, and we all can relate to that way of thinking because we've all done it. When we see tragedy, that's bad. Now let's move on with our day. Tragedy hits us. There's no, let's just move on with our day. Now there's weeping, there's stress, there's depression, and all the other things that come with it. So I understand that a lot of us are tired of talking about COVID-19. We don't want to think about COVID-19, but it's still there. It's still real. People are still getting infected and people are still dying. So we're going to have to spend some time talking about it. And I'm going to try to stress this right from the start before we get into everything everything that we're going to look at. And I'm going to probably be looking up some things as I'm talking here. So I want to just get this perspective. I want to make sure everyone understands where I'm coming from, because I think so many times people miss my perspective. They don't understand my perspective. So let me make it very clear. From my perspective, as COVID-19, as it relates to the church and what the church should do and how we should respond, let me make it very clear. I am not in any way, shape, or form worried or really even interested in what the government tells me I should or shouldn't do. And here's the reason why. I think as a church, my first thought should be, what is the most biblical, godly way to handle a pandemic in which people are being infected and which people are dying? What can I do as a pastor? What can we do as Christians? What can I do as a church? What can I do to help preserve life, protect life? What can I do to be a good witness and a testimony? What can I do to demonstrate that we love not only our neighbor, not only do we love our family, not only do we love friends, but we love even our enemies? What can we do to demonstrate a love for others, a desire to protect life, a desire to keep people safe? What can we do to demonstrate that we're trying to be helpful? We're not trying to be hurtful. What can we do to be salt? What can we do to be light? That's my perspective. I'm not worried about what the government necessarily says. I'm worried about what can we do to better reflect the love of Christ, a concern for people, and at the same time, maintain what the church is called to do, which is to equip saints. We're called to equip saints. We're called to be preaching the gospel. We're called to be discipling people. There are specific things that the church is called to do. How can we find a way to pull these off? I think we have to be thoughtful. We have to be considerate. We have to be as wise as a serpent, harmless as a dove. We need to be creative. We need to really think we really need to determine if I take action A, how is that action going to be understood and perceived by people outside of the church? How are they going to think? And we just really have to be thoughtful and not allow, and this is very important, that as a church, we do not allow this whole thing to become political. We don't need to see this through a political lens, through a biblical lens. And so I've really tried to get that perspective across, that I'm not worried about left or right, conservative or liberal, Republican or Democrat. I'm not worried about any of that. What I'm worried about is, as a church, what's the biblical response in the middle of a pandemic where people are getting sick and people are dying? All right. And I think that's very important. So let's do this. Before we get to some of the things I have here, let me pull this up really quick because I should be able to get access to this really quick. All right. I'm getting some breaking news there. Let's look at this. I'm going to pull up some data here. All right. I pulled up the COVID-19 dashboard by the Center for System Science, and they got a long name here. All right. The global, okay, I'm looking here. All right. The global, hang on, the page just froze. There's so much information on this page. All right, here we go. The number of global cases of COVID-19, 42,307,731. 42,307,731. That's how many global cases of COVID. Over 42 million people have been infected with COVID-19. I just want you to keep that in perspective, all right? And please note, just think of January 2020. January 2020, I was in Houston, Texas at Minute Maid Park, this large stadium, right? Baseball stadium. It's used for a lot of things. And I was there for a wrestling pay-per-view. I don't know, 60,000 people, 70,000 people packed into that building, 50, I don't know. There was a lot of people. I was in line with people. I mean, I was around people. That's January 2020. None of us were even talking about COVID-19 at that time. Very few of us. I mean, I was keeping up with what was going on in China, but at that point, obviously, I wasn't concerned enough about it because I was in Minute Maid Park with thousands upon thousands of wrestling fans. All right. So that's January 2020. Here we are, October 2020, and 42 million people have been infected with it, and over 1,145,847 people have died. Over 1 million people have died. Now, I know I'm going to get some people, those numbers can't be trusted. Those numbers are all a fraud. No one's really dying. Okay, you can go create full-blown conspiracy theory thinking. Great, you're wonderful. You know that no one's really dying. You know that all these numbers are made up. And you know that you can try to argue, well, how many people just die of COVID alone, and they ignore comorbidity and how that works. All right. I'm not here to get into a debate with you about there's no point in debating. Once you start buying into that, there's nothing I can do to counteract that. What I'm trying to say is January 2020, everyone's going on with their lives. No one's worried about anything. And the next thing you know, over 1 million people have died in less than a year. In less than 12 months, 1 million people who were once on this earth are no longer here. They have died. Now, every Christian who talks about being pro-life, every Christian who talks about the sanctity of human life and that life is sacred and that life, there's sanctity to that life, should be bothered, should be horrified that many people have died. All right. Now, you could say that people, that there are governments and there's forces out there using these deaths to their own political gain and their own political benefit. Well, you know what? Everyone uses everything for their own political gain and political benefit. They use good times. They use tragedy. I don't care what the politicians are doing. What I care about is that 1 million human beings who are created in the image of God died and have entered into eternity. They've either entered into heaven or they've entered into eternity separated from God forever and what we as Christians refer to as hell and then ultimately the lake of fire. That should bother you. But nobody talks about the fact that 1 million people have died. We talk, well, I don't really believe those numbers. I believe that's all God. Okay, well, let's say you're wrong and say 1 million people really did die. Should you not care? Should there not be some compassion? I'm not hearing the compassion or brokenness over the fact that 1 million people have died. I'm hearing, I don't care and blah, 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 blah. And I'm not going to do this and I'm not going to do that. It's all about you and what you think and what you want, not about the fact that people have died around us. That's a horrible thing. That's a lot of cases, right? Those numbers are not, they're not good. All right. In the United States of America alone, over 224,000 people have died. Over 224,000 people have died in the United States, 224,058 to be exact. That's horrible. That's horrible. And the number of deaths are increasing. They seem to be going up. Now, there is some good news. It seems like those who are in the hospital, the number of people who are in the hospital and being hospitalized for COVID-19, the death rate for people hospitalized seems to be decreasing, which indicates to me from my 22 years working in the medical world that people in the medical world have gotten much better in how to treat and how to preserve life with people who are infected with COVID-19. They're learning the best treatment practices, the best practices that are available out there. The information is getting shared from hospital to hospital, from medical administration to medical administration. They're like, here are the best practices, and then they're following those best practices, and they're able to preserve life better. That's great. That's wonderful. That's great. But that doesn't mean we just all of a sudden say, hey, everything's getting better and everything's wonderful. That's not the situation that we are in. I cannot stress this enough. We are entering in a situation where the next 4 months is going to be absolutely crazy. It's going to be absolutely insane. The number of people getting infected, the number of people dying, those numbers I think are going to continue to increase. And it's going to create situations where government leaders are going to have to make tough decisions. They're going to make decisions that people don't like. I think there's going to be more lockdowns. There's going to be more shutdowns. And people are going to get upset. People are going to get bothered. It's going to lead to more division in this country. It's going to lead to more divisiveness even within churches. Pastors are going to have to make decisions. People are going to get upset and people are going to get mad. And the pastor's in a no-win situation. You listen, we see this all the time in our culture. And this same thinking enters into the church. This is the way it works. People are like, don't tell me what to do. I'm going to do what I want to do. And then they do it, and then they get hurt. They get injured, and then guess what the next thing they want to do? I'm going to sue you because you didn't take the necessary precautions to keep me safe. You didn't protect my family. Now I'm going to sue you. So it's like one hand, let me do what I want, and then when I do what I want and then I get hurt, then I'm going to sue anyone and everyone around me. Well, that same mentality comes inside the church. It's like, Pastor, why are you shutting things down? Are you a coward? How come you live with faith over fear? Why don't you believe believe in God, you coward. And then the next thing you know, someone in their family comes to church, catches COVID-19, is sick and dying in the hospital. And then they're going to be like, Pastor, why didn't you care about my family? Pastor, why didn't you do what you can to protect my family? You're a piece of garbage. I'm going to sue you in the church, and I'm going to, and the next thing you know, they're attacking the very pastor who they once were like, you're wonderful. You can't win. If you keep it open and then people get sick, you're a monster. If you close it down, you're a coward. You can't win. And people turn on, look, we see it even in the Bible. There, at one moment, Jesus is walking into Jerusalem and everybody's like, Hosanna, blessed is he who comes in the name of the Lord. And, yes, wonderful Jesus. And the next minute they're like, no, crucify him. Give us Barabbas, not Jesus. Crucify him. Well, what changed so quick? Our sinful nature will do that. And so a pastor they can't win here. Close it down? Well, I don't know what's wrong with you. You buy into the hysteria and you're a liberal and, you get called every name in the book. You open up, everyone's like, you're a man of God. You're a man of conviction. You're wonderful. And then all of a sudden their family member gets sick and dies. You killed my family. Okay, so what exactly are you supposed to do? So this is going to be the next 4 months is going to be absolutely crazy. It's, I'm telling you. It's not going to be good. It is not going to be good. We're going to have the flu. We're going to have COVID-19. It's going to be I think schools that have opened are going to close. I hate to be, I don't want to be negative, but I am perceiving the next 4 months are going to be bad. And I predicted that once we got to the fall, it was going to be bad. And I think we're starting to see signs of that. But I just want you to have kind of an idea of how many people have died. Over 1 million people have died. That in a less than a 12-month period. That's crazy. That's something that should bother all. And people will try to relate it to, this many people die of this and this many people. Okay. And guess what? That many people will still die of those things. This is a new thing on top of those things. So you say, well, this many people die of this. Yes, and that many people are going to still die of that. This is on top of that. So that should bother you because that means more people are going to die. If you have this many people die of the flu and now this many people dying of COVID, well, now you have the COVID deaths on top of the flu deaths and you have even more death. That should bother you even more. Something else killing more people. All right. So I just hope that people will try to see exactly and try to see this from a more biblical perspective. Please, I beg you, I plead with you, Christians, throw out your politics, throw out your left versus right, your liberal versus conservative, your Democrat versus Republican. Stop with all of that nonsense. This is about human beings created in the image of God, living during a time where a pandemic has spread around the world. People are getting infected and people are dying. Are political powers using it for their advantage? I won't deny that. But that's irrelevant to me as a Christian. I could care less what they are doing. My job is, what do we do as a church? What do we do as Christians? What can we do to not be a part of the problem? What can we do to try to help, preserve, to do what we can? And there are many churches that are not helping the situation. Let me give you one example. Let me just give you one example. All right. Where do I have it here? Yeah, right here. Okay. This is from the Charlotte Observer. All right. COVID-19 cases grow to 82 and 3 people have died, and all of it is tied to a cluster from a North Carolina church event, or events, plural, because of multiple events. So there's a church in North Carolina, and now they've been able to track back to that church and its events, 82 cases, and 3 people have died. 3 people have died because of getting COVID-19 because of this church. Now, how many people have to die before a church is like, well, I think this is not such a good idea. The last thing I would ever want, I can't even imagine as a pastor getting notified that, hey, you had a church service. Someone got COVID in your church and now they died. Or someone in your church got COVID at your church. They carried that COVID out and gave it to someone else and they died. And it's directly linked back to your church. I can't even imagine that. I can't even comprehend that. I don't even know. Then basically I'm involved in murder. I can't live with that. I believe murder is wrong. I believe killing people is wrong, whether intentionally or unintentionally. I don't want to be involved in the death of anyone. So it's just crazy. And then the news article goes into some of the details, but basically it was a church that was like, hey, we're going to do what we're going to do. We're not going to follow the rules. And now people have died. And of course, they reached out to the church, and guess what? The church, in fact, they say they believe at least 1,000 people attended events at the church, based on videos that have been seen. They talk about, but here's the thing. Church leaders have not responded to messages from the Charlotte Observer, and a representative from and a representative wouldn't comment. So in other words, no one from the church is going to speak. Hey, people are getting sick and people are dying because of your church. Okay, let's just not say a word. Let's just not speak. How about come out and say, we accept responsibility. We are sorry. No. Churches are not going to play that game. They're not going to do that. Because they're going to just not say anything. And I've seen case after case after case. I've seen pastors who are like, I don't believe in the pandemic. And the next thing you know, the pastor's on a ventilator saying, I was wrong. And we need to take it serious. Well, it's a little late now, especially if other people in your church got sick and died. And I'm so tired of hearing people, like Christian radio continues to say this. We need faith over fear. We need faith over fear. Well, you can have faith over fear all day, but that doesn't mean you act in an irresponsible way. Let me offer a good example, right? I'm here in the middle of nowhere, Texas. There are times we have very severe thunderstorms and tornadoes. Well, guess what? If it's about 5 p.m. on a Wednesday, or 5:30 p.m., 6 p.m., and I get told severe thunderstorms going to be moving into your area, getting close to 7, potential for high winds, damaging hail, and tornadoes. Well, guess what? I'm probably going to contact people and say, just stay at home. Don't come to the church. I don't want you getting caught in a severe thunderstorm. We're just going to cancel services tonight. Now, does that mean I'm not having faith over fear? Do I say, let's have faith over fear? Let's just drive right through that severe thunderstorm. Let's do so. If I have a church in an area where there's a hurricane, do I conduct church services when a hurricane, a Category 4, Category 5 hurricane is about to come crashing into your area? No, you cancel everything. A wildfire, forest fire, same thing. There's all kinds of reasons churches cancel services. Is that because they didn't have enough faith over fear? No, because you have to use your brain. Well, if there's a pandemic and people are getting sick, you have to use your brain. It's not about having fear. It's about just being wise. It's about thinking about people, loving people, preserving life. John MacArthur's church, which he's being treated as a hero. And they keep saying, no COVID cases. We have no COVID cases. We have almost acting like it's not real. Well, now, supposedly three individuals, so far 3, I guess can be traced back to the church. And I don't know all the details yet, but we'll have to wait and see how that plays itself out. The lawyers representing MacArthur's church are saying they're upset because I think the LA Times called it an outbreak. I don't think 3 cases really should be called an outbreak, but I'll say this: if I have been very skeptical of them keep saying that no one in the church. I've been very skeptical of that because they've got over 7,000 people, 8,000 people are attending Sunday services. Here in my little church, in the middle of nowhere, Texas, we've had 2 individuals, two individuals with COVID. Now they did not. Far as we can tell, obviously they did not get it in the church. We've basically canceled most of our services, but that's 2 individuals connected to a little church. Well, if you've got over 7,000 people attending, I'm having a hard time. Like, no one. And look, maybe it's true. And if it's true, congratulations. Great, more power to you. But the point is, you're putting people at risk. And again, with John MacArthur's church, the thing that blows my mind is while MacArthur is saying there is no pandemic, there's signs inside the church basically saying, hey, if you don't do this, there's a chance you could get COVID, you could get sick and die. And Grace, this church is not going to be held responsible. Well, why do you need to put up a sign if there's no pandemic? And people keep telling me, well, they're doing that because they're fear of a lawsuit. Fear of a lawsuit from what? According to MacArthur, there's no pandemic. There's nothing to be worried about. So why put up a sign to protect yourself? Right? If there is nothing to be worried about, then don't put up a sign. Either demonstrate that you don't believe there's a pandemic, put up no sign, tell no one to take any precautions, and just can carry on. And then if people get sick and die, well, then you say you were wrong. But according to MacArthur, even if someone gets sick in his church and dies, he's still not responsible, which is just, it's just, a whole thing becomes crazy. So the churches are not handling this. And again, let me make it very clear. I think it's no win for a pastor right now. He closes down. He closes the church down. He's probably got 50% of the people in the church are going to disagree with him. He leaves it open. 50% of the people in the church are going to disagree with him. It's because we're becoming so divided over this. We're becoming so divided. And the division is, it's not real, it's a hoax, even though you can say, here are the numbers. You can talk to people in the medical world who are like, we can't, there's been a number of reports with hospitals like, we don't know what to do. We're being overwhelmed. Now, there's some hospitals that are not, and that's wonderful. But there are some hospitals that they're being overwhelmed. And they're having to fly people to other places and other locations. Well, do you not care about those people? Do you not care about the doctors and the nurses and them putting their lives at risk? Like, at some point, COVID-19 has to turn into a conversation about what is my responsibility to my fellow man. Like, remember Cain? Am I my brother's keeper? Hey, where's your brother, Cain? Am I my brother's keeper? You killed your brother. But he wants to, it's not my responsibility to know where he is. Well, of course. Listen, as Christians, you have a responsibility to your fellow men, to love them, to place them before yourself. What is the Christian responsibility in this? Well, we definitely can't say the biblical responsibility is to do things that put other people's lives at risk. That would be, I think all Christians should be able to agree on that, but Christians can't agree on that because they're not thinking about it biblically. They're thinking about it politically. They're thinking about it from a left-right paradigm instead of a Christian perspective, which says, man, what can I do to ensure that others are okay? Well, all of this, I'm saying all of this because, well, guess what? The COVID-19 situation right now is getting worse and worse and worse. Here's just a report that I heard this morning, right? Listen to this.
The U.S. is entering into what many believe is the pandemic's fall surge and the third spike since the start of this pandemic. There have been a record number of infections. Some of the worst outbreaks are actually now in the Midwest, with the situation being especially dire in rural areas.
Many of the communities that were spared in the spring and summer are now getting hit hard. Reporter Will Stone is following the path of the pandemic and joins us. Will, thanks for being with us.
Sure thing, Scott.
Of course, at the start of the pandemic, big cities were more seriously affected, which makes some sense when you consider urban population density. What we're looking at now are very different kinds of communities that are being struck. What do you see?
That's right. Cases have just exploded in the past month in rural America. They're now at record levels if you look at the number of new infections and hospitalizations. And what's striking is that cases started to pick up in early September nationwide across the board, urban, suburban, rural. But the growth in rural counties has completely outpaced what you see in the cities. It's really accelerated. And in the most rural counties, the rate of infections per capita is much higher than what we see in the big urban centers now. It's about double. And this makes sense because the Midwest, the Great Plains, parts of the West, these are more rural states, and this is where the pandemic has a foothold. But it's not only cases. This is what Brock Slaybaugh with the National Rural Health Association told me.
We're seeing the mortality rates much higher than urban. And of course, we know that rural populations tend to be older, sicker, and poorer.
Which means they're more likely to get seriously ill if they catch the virus.
Will, do we know why cases in rural states are surging?
I've been trying to get at this question in my reporting, and there's no one reason. To an extent, public health experts expected the pandemic to shift from the cities to more rural communities. We saw this trend with HIV, for example. And once the coronavirus gets to these rural areas, it can be really hard to slow it down because they don't have the resources like big cities. I've also had people tell me there's been a sense of complacency, a feeling that this was an urban problem, almost a myth that being more spread out means you're not at risk. And there's clearly a political element here. Rural America skews conservative, and people who work in healthcare in small towns in states like the Dakotas, they tell me that not everyone thinks the pandemic is that serious. And just this week, I heard the governor of Ohio call out rural areas in his state for not wearing face masks as much.
How are states and how are hospitals trying to cope with the situation?
Well, hospitals are scrambling to find room. Listen to what Dr. Joshua Kern said recently. He's with St. Luke's Hospital in Twin Falls, Idaho.
I think we're all alarmed and frankly kind of scared about what is to come. We're being overwhelmed with patients, and frankly, there's nowhere to send them. Most of the hospitals in this area are experiencing similar issues. There's not really a cavalry to come. We're it.
This past week actually had the highest number of COVID hospitalizations that we've seen in the last 2 months. So in Wisconsin, they've set up a field hospital. In Utah, some of the big hospitals in Salt Lake have maxed out their ICU capacity. And this puts a huge strain on the entire region because the smaller rural hospitals don't have the staff or beds, so they count on transferring patients to the cities. But that's getting a lot harder since everyone is increasingly busy, and it looks like the trends are moving in the wrong direction.
Reporter Will Stone, who's tracking the path of the coronavirus, which now is gripping the Midwest. Will, thanks so much.
Thank you.
Okay, that's just one report. I could literally play 15, 20, 30 reports about all the things going on. Let me just read some headlines. Daily COVID-19 cases will hit 6 digits soon. Experts warn as U.S. reports a one-day high. This is here in the United States of America, of more than 83,000 infections. More than 83,000 infections in one day in the United States of America. I don't care. Again, I don't care what the government says. I don't care about restrictions, lockdowns. As a Christian, what should your response be to that? Your response should be, obviously, to pray. And what can I do to do everything to ensure that I do not hurt anyone, that I can do everything I can to preserve life? What can we do to be salt? What can we do to be light? Here is this report. The United States marked a horrible milestone and recorded its highest one-day number of COVID-19 infections Friday at more than 83,000, more than 6,000 higher than the country's previous record set in July. So we just broke a single-day record in October. Now, according to some, and I won't say who, a certain political leader that many Christians love, hey, it's over. We're rounding the corner. It's all getting better. No, it's not getting better. What are you? That's not the message. Okay. As the fall surge continues, the daily numbers will get worse. Is the prediction? That's the prediction. Is that the numbers are going to get worse? Well, we just broke the single day record. After this long dealing with the pandemic, we just had. You think by this point we should be on top of this, but we're not. They continue here. We easily will hit 6-figure numbers in terms of the number of cases. A director of the Center for Infectious Disease Research and Policy at the University of Minnesota told CNN Friday night. And the deaths are going to go up in the next 3 to 4 weeks. Now, please note, that's very important to remember. All right, I've tried to state this. If you get a single day record of 83,000 new cases, the death rate always is behind. So you can't look at the death rate today because we just had the big surge of cases. So what you have to look at is in about 3 weeks, in about 4 weeks, in about 5 weeks, guess what will happen? The death rate will start going up because the people who are just infected and just got their test that they're positive, then they have to go through the whole cycle of the virus. They're going to either have a severe infection or not. They're going to recover, or they're going to get worse, and they're going to get worse. And about 3, 4, 5, 6 weeks, we'll find out if they survive and recover or if they die. And so then the death rate is going to start going up. It's how it always works. You first get a surge in new cases, and then the death rate begins to creep its way up. And people will manipulate this and go, well, we got 83,000 new cases, but look at the death rate. That death rate is 4 to 6 weeks behind the current infections. So they're saying, hey, that in the next 3 to 4 weeks, the death rates are going to go up, following usually new cases by about 2 or 3 weeks. So they say it's about a 2 to 3 week behind. I will say 4 to 6 weeks, but okay, 2 to 3 weeks. You can follow it. This comes as the country's 7-day average of new daily cases surpassed 63,000 Friday, an 84% increase since the average started ticking back up in mid-September. All right. So the numbers are going up. And then I could get here and give you more detail. 34 states report rise in cases. And many are saying that a vaccine is not going to come this year. It's not going to come this year. And even if a vaccine comes, many of the people who say there's no pandemic, they're not going to get the vaccine anyway. So, at that point, it's not going to matter. Let me see. Let me go to some other headlines here. I've got so many different headlines open here that it's not funny on my iPad. Let me go here. Now, according to this, deaths, all right, could hit 500,000 by February. Now, of course, sometimes these models are not correct. I'm the first to acknowledge that. But whenever you see a headline like that, we have to look at it. This was published yesterday, all right? Total United States COVID-19 deaths could hit 500,000 by February, researchers say. Now, that would just be in the United States of America alone. That by February, we could hit 500,000 deaths, all right? The U.S. death toll from COVID-19 could surpass 500,000 by February unless nearly all Americans wear face masks, researchers said on Friday, as 14 states set new records for one-day increases in infections. Now, of course, people say, well, the face masks don't work, and I'm so tired of hearing all the arguments about face masks. I'm so tired of hearing it. Worked in the medical world for 22 years. We would wear masks in all kinds of different situations. But no, they don't work. I get so tired of it. I can remember we had a one sergeant that I worked with that we used to call her the face mask Nazi. That we really would, because if anyone walked into the clinic, if anyone walked into our floor, the primary care floor, depending on where I was working, whenever I worked with her, because I worked her in a lot of different locations, someone would just go, put a mask on, put a mask on. Someone would go, put a mask on. And she would just be like, she would put a mask on, put a mask on, put a mask on. She would yell at everyone. She basically wanted everyone wearing a mask 24 hours a day, 7 days a week. She didn't care what. And that was that was years ago, before there was COVID-19. But because we knew that putting a mask on can help prevent you spraying stuff all over the place, your spittle, you sneezing, you coughing, sending stuff all over the place, that it can reduce that. Now, no one says it's perfect. And yes, you can find arguments for this and arguments for that. You can say, I've read and heard all of the debate and all of the debate and all of the debate. But here's the thing. You can debate. But I'll state this again. Even if it only helps by 20%, even if it only helps by 30%, if it only helps by 10%, why would we not want to do everything in our power to try to help so that we can get past this, we can get on top of this, we can get COVID-19 something left in the history books, and we can move on and reopen everything and get back to life as normal. Unless people are willing to do everything in their power, do everything. Look, there's things we cannot control, right? There's things we cannot control. we can't worry about those, but we can do what we can. We can do the things that we can control. I can social distance. I can be washing my hands like crazy. I can wear a mask. I can avoid large gatherings if all possible. The church, we can do whatever we can to try to ensure that people are safe. We can take the precautions that we can and do what we need to do in order to preserve and save life and try to get past this. It's almost like people are like, I don't care. It's just going to happen if it happens. And then when someone in their family dies, all of a sudden they do care. When it's someone in their family on a ventilator, or if there's someone in their family at a hospital, like we don't have any room for your mother or your daughter or whomever they may be, and we've got to try to find them a place so they can get treatment. Then all of a sudden they're screaming, why me? Why? Why is this happening to my family? No, not my mother. No, not my daughter. And then they're all upset. Well, yeah, that's what happens in the middle of a pandemic if people don't take precautions. Now, there's things we cannot control. There's things we can. I don't need a government. We should not need a government mandate to tell me what to do. And I should just be asking myself, what can I do to try to help other people? What can I do to not harm other people? What can I do to protect myself? What can I do to protect my family? What are the minimal things that I can do? Well, the minimal things we can do has been stated like not over and over and over. Social distancing, wash your hands, avoid large gatherings, right? And wear a mask. Those are like the basic things that we've been told to do. Basic. And people act like that those very basic things you've been asked to do, that somehow the new world order has taken over, being ruled by Antichrist, and that if you do these four things, you've compromised your Christianity, you're destroying the world, and we're all going to be locked up in some concentration camp and we're going to be put to death. It's like, where's the balance and reason, right? Like, these are very minimal things. And I know people say, well, no, it's not minimal when they ask you to shut the church down. Oh, I agree. That's not minimal. But here's the thing. There's so many different ways I could go, but let me just state this again and again, because sometimes I feel like I'm just saying the same thing over and over and over, but I got to keep saying it over and over and over until people listen. I'll be upset. I'll be very upset about any call for me to shut my church down when I turn on my television and I watch a sporting event and there's 70,000 people in the stands and I'm not allowed to have church. I'll be upset when the local bars in my city are packed with people, but the church is not allowed to meet. All I'm saying is when churches get so upset, like they're coming after us, and I turn on my television. Last night there were some college football games on. There was no one in the stands. There was minimal people in the stands. Tomorrow night, I'll be watching a wrestling pay-per-view. Guess what? It's a big wrestling pay-per-view. Usually there'd be 18,000, 20,000 people for this pay-per-view. Guess what? There won't be anyone. It'll be empty. Well, when I'm seeing that on television, clearly that's not an attack upon Christianity. That's not an attack upon the church. And trust me, all of these businesses, they're losing millions upon millions of dollars. They're laying off people. They're hurting people. So clearly it's not just an attack upon the church and trying to shut the church down. People everywhere in all walks of life are being impacted. All kinds of people. All right, my daughter who works for American Airlines, she got furloughed. They're furloughing thousands upon thousands upon thousands of people. So this is not just an attack upon the church. American Airlines is not a church. Wrestling companies are not churches. Football teams and the National Football League, the National Basketball Association, the NBA, and when they went to the playoffs, even the World Series right now, watch those games. The stadium is empty. Why? Because of COVID-19 restrictions. So it's not like, oh, they're just coming for me. They're just coming for the church. So here's what I want to do. I just wanted to bring a lot of this information, just remind you of this information. It's all over the place. Now, I know you can start, searching for blogs and people trying to argue counter to all of this. Go for it. Here's what I'm going to say. So listen to me carefully. The next couple of months, next 4 months, I'm going to put 4 months, it's not going to be good. it's going to be bad. And I have a feeling that there's going to be many areas that's going to re-implement. They're going to re-implement some restrictions, some lockdowns. There's going to be some schools that probably go back to just virtual online learning. And there's going to be churches. Churches are going to have to figure out how we're going to do this, how we're going to handle this. How are you going to follow guidelines? Are you going to, I mean, to me, what blows my mind is the churches can't seem to develop a very nuanced and thoughtful approach. For example, if you live in an area where they tell you you cannot have church and you decide to break that rule, you think then at the very least you would do is like, hey, we're going to break the rule because we don't believe you have the power to tell us what to do. But you know what we're going to do? We are going to do everything in our power to protect the people who show up. We're going to make masks mandatory. We're going to do everything we can to ensure social distancing. Instead of having one big service, we're going to have smaller services, and we're going to break them up over a period of time. And we'll have multiple services, and so that a smaller group of numbers of people can come in. We'll limit how many people can come in. There's so many different things churches can do, but most of the churches who decide they're not going to follow the rules, they just go all in. We're not going to follow any rule. Nobody's going to wear a mask. We're not going to do anything. And at that point, you just like, are you worried? Are you just trying to make a point? Are you just trying to figure out how to see? There's a difference between I'm trying to figure out how to navigate a global pandemic while at the same time trying to be the church, right? That's one approach. Hey, I'm trying to navigate this. I'm trying to figure this out because I want to do everything I can to preserve life, save life, but at the same time, I've got to be the church. Okay, I can respect that. But then there's this other side that says, you know what? Don't follow any of the rules. Now, to me, that's not you trying to navigate a global pandemic. That's you trying to make a point. That's you because you have a political agenda. You have a political perspective. And so many times what we have seen is many of the churches who say, don't follow any of the rules are the same churches saying, if you don't vote for Trump, you're not a Christian. If you're not a Republican, you're of the Antichrist. And then you start hearing all of these political comments come out of their mouth. Well, are you trying to make a political point? Are you trying to figure out how to best navigate a pandemic so that you can be the church and yet keep people safe? What's your true agenda? Now, I got no problem with the person that says, look, I don't know if I can follow these rules, but I'm going to do everything in my power to keep people safe. Okay, I can respect that, even if I may disagree with your approach. At my church, now we're a small church, and because we're small, we can pretty much do social distancing, in a service. We can pretty much pull that off for the most part. Now, the sanctuary is not gigantic, so we are in kind of a closed area, but we've done a couple of things. We've gotten rid of Wednesday night service and Sunday night service. We're trying to have just a Sunday morning service. We're not having a Sunday school class right now. So we're not just doing the one hour service at church. And we've suspended singing. So we've taken some cautious. Some people, I have not made mask mandatory. I've encouraged people to wear them. Some have shown up with masks, and I'm thankful for that. I try to stay as far away from everyone as possible when they walk in. No, I'm not shaking anyone's hand. I'm not getting anywhere close to people. If I talk to them, I'm trying to stand back. I'm trying to maintain my distance because if for some reason I was exposed to it, I would feel evil incarnate if I infected someone in my church and they got sick and died. I would feel horrific for that. And then we try, if anything happens locally where I'm like, okay, well then I'll just notify everyone we're just going to do live streaming this Sunday. We've tried to take every approach. And so I may try to add a service. Maybe we'll do a Wednesday night service. We even have fewer people who'll show up on a Wednesday night. Maybe we'll just do a Wednesday night service one week and not even do a Sunday morning service. We're going to try to mix it up and try to be careful because we do have a little bit of freedom because we are so small. But if I was a pastor of a large church, I would do everything in my power to say, okay, how can we work this out? All right, let's do a service at 11 a.m. We'll do a service at 1 a.m. And we'll do a service at 6 p.m. Or we'll do not 1 a.m. at 11 a.m. at 1 p.m. and at 6 p.m. I would try to break it up into 3 services and to have and to limit the number of people who can come into each service, or you have services throughout the week, right? Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. Have a service every day of the week and just limit how many people can show up and say, here are all the times. And of course, the one thing every church can do, they can do what I'm doing. Every church can turn on a microphone and go live 24 hours a day, 7 days a week, and broadcast the preaching and teaching of God's word and commentary about what's happening in the world right from the safety of their sanctuary. I'm sitting in the sanctuary here at Victory Baptist Church. They could do so in their sanctuary. They could do it from their office. Some of these churches have $1 million budgets. They could build a studio, right? And many of these churches have multiple teaching elders, right? Like more than one teaching. They may have the main teaching pastor, but many of them have multiple teaching pastors and elders on the staff. Well, then you literally could get, hey, I'm going to be at the church for 4 hours and I'm going to do live broadcasting. Then we'll take a 30-minute break. Then you come in, you take over for 4 hours of broadcasting. You literally could have your church broadcasting 24/7. Churches, though, aren't even taking advantage of the technology that they have available to them. Yeah, it's not a good situation. It's not a good situation. And please, so I'll end with this. Please get the politics out of your thinking. Please. Think about this in the most biblical way possible. And secondly, please avoid division and fighting with fellow Christians over this. We got to do our best to try to work this out. Look, there's churches out there and like the thing that bothers me about some churches, and I will call out churches, is when to me they're hypocritical, they're inconsistent. Look, churches all over the country canceled services prior to COVID-19 for all kinds of things. They canceled services for bad weather. They canceled services for activity. They canceled services for bad weather. And all of a sudden a global pandemic, and they're like, we cannot forsake the assembly. Well, you can forsake the assembly for 50,000 other things, but all of a sudden you can't for that inconsistency bothers me. But here's the thing. Pastors are going to have to struggle to make the best decision they can. They can. And it's not going to be easy because I think pastors are in a no-win situation. They close everything down, 50% of the people are going to get mad. They open everything up, 50% of the people are going to get mad. If they open everything up and someone gets sick and dies, everyone will come after them. It's a no-win situation. So please, when it comes to pastors, please do everything you can in your church. Try to be helpful. Try to be supportive. Try to get everyone to think about things from a logical, rational perspective. Try to avoid conspiracy thinking. Try to avoid the craziness. But we have to, as churches, we've got to come together more than ever. We've got to do what we can. All right? And I know this. The next couple of months, I have a bad feeling that the next couple of months, we're going to go back to just live streaming only here at Victory Baptist Church. I do not want to say that. I don't want to see that happen. I'm praying that I am 100% wrong. But I know this. If we do that, guess what I'm going to do? I'm going to do everything in my power. Sorry, had to sneeze. And no, I don't have COVID. All right. But I had to sneeze. See, I had to sneeze. See, that's what happens. If people were present in this room right now and I sneezed, see, that's not a good thing, right? So, but you get the idea. I didn't do that. I didn't do that for dramatic reasons. I really had to sneeze. But here's what I know. If we have to go back to just live streaming only here at Victory Baptist Church, you know what? I'm just going to try to increase the amount of teaching that I put out. I'm just going to try to show up to this church hour after hour. I'm going to turn on this microphone. I'm going to teach this, cover this, talk about this. I'm going to make the most of it. I'm going to ensure, look, there is nothing stopping us from feeding the flock. There's nothing, we've got the technology available. Be creative. Be creative. Use technology. Some of these churches that are throwing the biggest fit, it drives me crazy because they're the ones with $1 million budgets. They got $1 million budgets, hundreds of people on their staff, and it's like they can't seem to figure out a creative way to be able to minister to people. And then here I am in a little church with no money, and we're in the middle of nowhere. We've got very little. We don't have money. I don't have hundreds of people on the staff. It's just me, and very little. We have very little equipment available to us. I have a microphone and a laptop. It's what we have, and we're able to pull some of these things off. So it just makes you question, like, why can't the big churches do it? Why can't, like, I could think of all the things they could be doing right now. Literally, they could be live streaming 24 hours a day, 7 days a week. They could create we did a little test. You can create a 24/7 station on Live 365 where you upload all of your sermons and just let it play 24/7, one sermon after another sermon. There's so many different things you can do. They could create a channel for, I think, Roku. It's easy for the Roku streaming device. I think it's easy to create a channel on there. They could create a channel to, if their sermons are videotaped, they could just do video streaming. I mean, there's so many things. They can create an app. There's so many things they can do. They can do live YouTube streaming. There's so many things they can do. They've got millions of dollars. But instead of finding all of the solutions, it's like they want to make a point. And when you want to make a point simply to make a point, then you got to call into your question the motive. The motive should be, I desire to minister to people. Okay, what is all the ways I can minister to people that are currently available to me? All right, let's utilize all of these. Now, we still want to be able to be a church, and we still want to be able to get together at times and not forsake that. So what are some ways we can do that would ensure the safety of everyone and ensure the safety of those around us? I don't know. Whenever I state these things, I try to stop and listen to myself and go, does that sound really that extreme? Do I sound, and then I'll get emails like, you're of the Antichrist. You are surrendering to the government. You are succumbing to the government. The government's going to shut your church down. You are evil. And I'm just like, what did I say that was so irrational? I'm offering very rational solutions, but you can't, I guess rational solutions is not what we are looking at anymore. So there you have it. I'll stop right there. Yeah, so many things to talk about. It's the next couple of months. All I can say is pray, be safe, be wise, be as harmless as a dove, as wise as a serpent. Be thoughtful. Think about others before yourself. And please, 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 do everything you can to support your church. Support ministries that you feel are trying to equip and feed people. Do what you can to support, because it's going to be a tough it's going to be a tough couple of months. It is. Obviously, I'm here to do anything I can to try to feed people spiritually. If you have a prayer request, we definitely can pray for you. And we're gonna have to stick together as Christians, because the next couple of months, it's not going to be good. I'm hoping this all turns around quickly and the numbers start decreasing dramatically. But I think everyone's reached a point that they're tired and people are just not going to follow the rules anymore. They're going to do whatever they want. And I think people are throwing off the mask. And I think we're getting ready to see an explosion. And I don't think it's going to be good. And people are going to start dying. And you can deny. It's easy to deny. To me, it's a lot like Holocaust deniers who deny that the Holocaust ever happened. Well, because you didn't see it, it's easy for you to pretend it didn't happen. Look in the face of someone who survived a Nazi concentration camp and tell them that it didn't happen. That's a whole different story. That's a whole different story. People are dying. That's the reality. And you can say, well, based off this, I don't think it's that serious. Yeah, it's always easy to say that. That's like, hey, my kid got, my kid got hit by a car and is dead. Well, that's really not that big a deal, because that's only one death. I mean, look at the population of the world. Look at the population of the world. That's not, your child is just one out of the population. I mean, you know how many people die of being hit by a car each year? Not that many. So it's really not that significant. No, when one person dies, it's significant, okay? And when you have a global pandemic that's spread around the world and over 1 million people have died, I don't know. I think that's pretty significant. So, all right, I'll stop there. Just some thoughts. You can email me all of your disagreements, all of your complaints, all of your name calling to newsif@yahoo.com, newsif@yahoo.com. If you want to use your energy and time to spew forth hatred and disagreement, feel free to do so. newsif@yahoo.com, newsif@yahoo.com. And let me make it clear. There's some people who disagree and they're respectful and thoughtful and offer a counter perspective. And then that's not what I'm talking about. I'm talking about the people who just start bombarding me with name calling and craziness and conspiracy theories and stuff they give me that you go look up and in 5 seconds you're like, that's not true, that's not true, that's not true, that's not true. It's like, why am I going to engage with people who can't even get their facts straight? At that point, it becomes frustrating. So, all right, I'll stop right there. Email me. Everyone have a great day. God bless.